And more than 40 states across the country are now reporting substantial increases in COVID cases and hospitalizations. This comes as new hotspots emerge in the Northeast. ABC's Eva Pilgrim has the latest. Hi, Eva.
Today, as nearly every state in the country is seeing an increase in COVID cases, the U.S. is inching closer to a grim milestone. More than 997,000 people have died from COVID in this country, and it is likely we will cross the 1 million death milestone within the next week. The current hotspot for cases, the Northeast. That's New York, New Jersey, and all of New England. However, despite the rising cases, the number of average daily COVID-related deaths continues to drop. Right now, the average is 340 daily deaths. To put that in perspective, at the peak of Omicron, we were averaging 2,600 daily COVID-related deaths. So what can you do? Health officials say make sure you've gotten your vaccinations and boosters. 54 million Americans are completely unvaccinated, and another 91.5 million, about half of those currently eligible, have not gotten their booster shots. Diane?
All right, Eva Pilgrim, thank you. And ABC News contributor and chief innovation officer at the Boston Children's Hospital, Dr. John Brownstein, joins me live now for more on this. Dr. Brownstein, according to the CDC, infections are up 22% from last week nationwide. Is that just part of the ebbs and flows that we should expect from these numbers, or is this cause for concern?
Well, I think, Diane, it's about both things being true. I think that we have to be somewhat concerned about increases in cases, and especially how that will have an impact on severe illness and death. And this is a convergence of relaxing restrictions, masking, and now a more transmissible variant. We have this subvariant of BA2 that is 30 to 80% more transmissible than the original Omicron. And so I have a concern. I have a concern for those who are unvaccinated, not boosted, those who are immunocompromised that can't mount a significant response to the vaccine. And I think overall, we're somewhat lax now. Because we're doing these home tests, we don't fully see the full spectrum of what's actually happening in the community. And that's a problem for potentially our health systems, because once you have a lot of transmission in the community, that can lead to surges that really impact our capacity. So we're still not in a position where we can predict reliably what's going to happen with this virus so that we can adequately prepare for what's coming.
Now, Dr. Brownstein, hospitalizations are up, but the number of COVID-related deaths are still dropping. What does that tell you?
Well, that is very good news. What we were seeing is something you and I have spoken about a lot for the last couple of years, which is uncoupling. This idea that cases will increase, but we're not going to see the subsequent impact on deaths. Yes, we still have, unfortunately, hundreds of those dying from this disease every day, but we're not in the same place we were, as we just heard from Eva, around Omicron. That's a really good news. And we're seeing that split happen in the Northeast because we have a lot of boosting and we have a lot of testing. My worry is in the South, where there's less vaccination, less boosting, less testing. That will be a problem as we see this BA2 subvariant come. And so I am somewhat worried about a surge this summer in other parts of the country.
Now, the White House has been asking Congress for $22.5 billion in emergency aid to continue responding to the pandemic. The White House says without that funding, the country could see 100 million new COVID infections across the U.S. next fall and winter. Why?
Well, first of all, we have to say 100 million is just a potential forecast. There have been many forecasts throughout this pandemic. Many of them have been wrong. But at the same time, we do expect a surge this fall. We will probably have another variant, and we're going to have to deal with it. And we need the strategies to deal with a new virus as it emerges. And so those are things like improving indoor air quality. Those are the new vaccines that we keep talking about that are more targeted to existing strains. They're funding for therapeutics. There's a wide variety of areas where we know we can combat this virus, even things as basic as making masks available to the American people. All those mitigation strategies combined put us into a place where we can live with the virus. But if we don't invest in that capacity, we're in for a really tough fall and winter this coming year.
And Dr. Brownstein, we're now hearing some new reports about long COVID in children. What do parents need to look out for?
Well, this is really concerning, and this is something that is just understudied. We just do not have enough research into understanding long COVID. There have been 13 million kids, at least, that have had COVID throughout this pandemic, and there's estimates about 2 to 10% that have experienced some form of long COVID. There's a number of different symptoms, actually up to 200 symptoms that have been described as long COVID in kids. They can be potentially, fatigue or brain fog. They can be more cardiac, like heart palpitations, or they can be actually stomach problems, loss of taste, loss of a smell. So all of these constellation of symptoms really need to be studied. It's hard, of course, for parents to identify these things. Sometimes it does go unnoticed. So highly recommend that if any parents have concerns about their kids, please see their primary care physician or pediatrician immediately to figure out what is actually happening.
And I understand in some cases the child can appear to have recovered from COVID and then you start getting symptoms again. So how can you tell what is long COVID and what is a different, illness?
Dan, that is such a good question because we just don't know. And this is why more research needs to happen. It is possible for that child to be asymptomatic for several weeks and then get those symptoms. It's very hard to test for. And so the science has not caught up with the impact that's happening in kids. And this is why, another reason why, we need real funding into COVID to sort of mitigate these impacts in our kids going forward.
All right, Dr. John Brownstein, great to have you. Thank you.
Thanks, Dan.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.